Also, later this half hour, Raymond Donald Hong will bring us Betty Sullivan's Health Matters segments on a drug-resilient disease, MRSA, that caused a media fiasco targeting the gay community when it was incorrectly released by researchers at the University of California at San Francisco.
Our very own poet, if not yet laureate, Bruno, will bring us a reading of his ode to the California Supreme Court decision to rule on gay marriage.
This is Betty Sullivan for this month's Health Matters segment. In mid-January, the University of California, San Francisco issued a news release about a new strain of drug-resistant staph infections. It's called methicillin-resistant Staph aureus, or MRSA. Dr. Lisa Capaldini is a practitioner in internal medicine with an emphasis on HIV care in San Francisco's Castro district.
MRSA stands for methicillin-resistant Staph aureus. So let's start with the Staph aureus part. Staph aureus is a bacteria that's on our skin, and when it acts up, it causes abscesses or skin infections or boils. Methicillin-resistant Staph aureus, or MRSA, is a particular type of Staph aureus that is characterized by acting up unusually quickly and by being responsive to a smaller set of antibiotics than regular Staph aureus. And when MRSA really is there, it's not subtle. It's a nasty boil or a nasty skin infection that hurts and is progressive.
But what was alarming about the university's news release were the phrases that were misleading. The inflammatory language implied that the gay community in San Francisco was the epicenter of this deadly strain of MRSA, and that it would cross over by casual contact from gay men to the rest of the population, including women.
Sexually active gay men in San Francisco are about 13 times more likely to be infected. We are also very concerned about a potential spread of this strain into the general population. Potential widespread dissemination of multi-resistant form of MRSA USA 300 into the general population is alarming.
The press release caused nationwide mass media confusion and misperceptions about gays, not unlike the AIDS epidemic when it started 25 years ago. The Centers for Disease Control and Prevention issued a statement to clear up the confusion.
It is important to note that this is not representative of all men who have sex with men. The strains of MRSA have also been found in some persons who are not men who have sex with men. So conclusions cannot be drawn about the prevalence of these strains among all men who have sex with men.
Whether there's anything that gay guys are doing with regard to sexual contact, going to the gym, bathhouses, or whether this is just a simple epidemiologic issue of once one group has it, people in that neighborhood will tend to get it through casual exposure, is not clear. I've had little old ladies who live out in the Richmond get this, and I've had sexually active gay men who have multiple partners who haven't gotten it. So we really don't know how it's being spread with regard to specific locations or specific activities. The idea that MRSA is in the news right now seems a little behind the times to me, quite honestly. In my practice in the Castro, MRSA infections peaked about 1.5 years ago. And at that time, I was hospitalizing someone with MRSA, typically for surgical drainage, maybe once or twice a month. Now that my patients are aware of MRSA and doctors are aware of what the right antibiotics are, I haven't had to hospitalize someone for MRSA in over 6 months. So my guess is that some of this media interest has lagged behind the actual clinical peak of the epidemic. I don't think it is a new problem, and I think it's less of a problem than it was 1.5 years ago before we were able to identify this.
Gay activist Michael Petrellis fired off a response to UCSF.
The logic of your recent alarming press release about staph infections makes us others and not woven into the general population. You went out of your way to mention 4 times that gay men are not considered by UCSF to be members of the general population.
UCSF issued a personal apology to Petrellis and released a public statement.
We regret that our recent news report contains some information that could be interpreted as misleading. We deplore negative targeting of specific populations in association with MRSA infections or other public health concerns, and we will be working to ensure that accurate information about the research is disseminated to the health community and the general public.
I think it's important to recognize that Infectious diseases historically have carried with them a lot of baggage around pandemic and contagion and fear and so forth. In the vast majority of cases with MRSA, people don't have it. And for those people who do have it, it is readily and easily managed with simple medical care, either antibiotics, draining an abscess, or both. So if you notice a really sore area in your skin that's hurting you, you should get medical attention whether or not it's MRSA. And if it is MRSA, it can be managed.
In San Francisco, this is Betty Sullivan for Outlook Video.